This is Buffalo What's Next. I'm Jay Moran.
I'm Bridget J. Paul Valenza.
And I'm Dave Debo. If ever there was an issue that demands more discussion now, the racist massacre at Tops Friendly Markets on May 14th is it.
You know, America has a long, deep, rich history of racism brutalizing black communities.
But where does it go from here? What does our community need?
We must work and teach our children.
What issues just aren't being addressed?
As long as we keep doing the same thing, we're just sitting ducks for the next mass shoot. That's all you can say.
This is a new program. Every weekday, we'll set aside this hour to hear from the community about issues that can no longer be held back.
We need to make a concerted effort in our nation, in our institutions, and yes, in our family.
And good morning. This is Dave Debo. On the program today, we're going to be talking a little bit more about health disparities. You've heard us mention it in the past. You have probably heard the phrase social determinants of health. You're going to hear that phrase again today. If we're talking about the shootings on the east side, if we're talking about the environment in which people live, that is absolutely part of the discussion. Coming up in just a little bit, Jay Moran will bring that discussion forth with Reverend George Nicholas. He's co-convener of the African American Health Equity Task Force. He's with the Buffalo Center for Health Equity. He, of course, is pastor at Lincoln Memorial United Methodist Church. He's the guy that started talking about health disparities, I think, really a lot long before the shooting and long before it came forward in the public consciousness. So stick with us for that. It's going to be a great conversation. But in the meantime, we're going to talk about conversation. We're going to talk about language. We're going to talk about DEI and sometimes even DEIB. There's a new phrase out there. We'll get to that, and we'll get to all of it with Dr. Brianna Cornelius. She's an educator at the Park School in Buffalo. She's a linguistics expert, and she has, I don't even want to call it a theory, but she believes, as I think it's fairly obvious, that in a lot of ways, the language we use shapes our reality. Dr. Cornelius, thanks for being here.
Thank you so much for having me.
I want to talk a little bit about background. You are a black woman. You grew up outside of Buffalo, but in an area in the South that is very similar to Buffalo's east side.
Yes, sir.
Do a little comparison for me.
Wow. Well, I'm from Memphis, Tennessee. I grew up in a neighborhood called Douglas in North Memphis, which I grew up being told that it was named after Frederick Douglass. I cannot confirm or deny that, but that is the narrative. Predominantly black neighborhood, lower income. My mom grew up there. My grandparents moved there years ago and built a home. And so it was a community, but in close-knit. But over time, especially in the 90s when I grew up, gang violence took over. Just life on the streets kind of took over because of class disparities and access to efficient health care and just an environment that was healthy. The entire neighborhood basically is designed like a pentagon. And so on two sides of the neighborhood, there are train tracks. And so there was just constant smoke and exposure to these freight trains. On two other sides, there were factories, one of which my grandfather worked at 50 years ago, that released petrochemical, all kinds of toxins into the air. And on the fifth side was an interstate. So on all sides, we were getting all kinds of exposure. And at this point, the area code 38108 actually has an infant mortality rate that rivals many third world countries. And so when I moved to Buffalo and wasn't making very much money as a grad student, I could not afford to, live in an apartment on Elmwood. But also I wanted to be in an area that felt closer to home because, believe it or not, in many ways that felt safer to me. I didn't have to worry about walking into my apartment and having a neighbor who thought I didn't belong there, call the cops on me. So I was very mindful about living in a space that felt like home and a community to which I could contribute. And so I found that in the East Side, the same sense of community, a lot of older residents, but also a lot of the same issues that I could help solve, hopefully.
I think during the course of this program, we've heard that from a lot of people, that it's really, despite all the challenges, that it's very much a tight-knit, close community.
Absolutely.
Talk about the racism in Memphis. Memphis, I think of as being deep south.
Yeah.
And therefore, to my mind, guys in hoods and burning crosses come to mind.
Yes.
Still, when you were growing up in the 90s?
Not burning crosses that I saw, but I Distinctively, I remember watching the news, and like there were times when the KKK would go downtown and they would march. I mean, relatively peacefully, if you would, but they would, stand outside and like line up and march, and the news would cover it. And I was like, oh, they're out, again, protesting for whatever reason, and it just kind of was the norm. And this was probably as late as the late 90s. So it was very much, it's still a thing. I think the difference between that and here is that back home, with or without the hood, you are very aware of who falls where. You don't go home with someone with the Confederate flag on their truck. You know what I'm saying? Like, you are mindful. We all kind of live in our own worlds. We mind our business. I know who you are. I'm not going to that part of town. If it's a sundown town, I'm not driving through it. I tell my brother all the time when he drives back and forth from Atlanta to Memphis, you get gas. You know where to stop. When you run out of gas, it's like a 6-hour drive, and then you keep going. You do not stop until you get home. So I think we're more vigilant because we're more mindful and aware of the blatant racism. Here, not so much.
More insidious, would you say?
Absolutely.
Really?
Yeah, because you just, no one just outright says, hey, I don't like Mexicans. I would say, someone from like the Latinx community, but like you don't hear people. They're much more mindful about their language. They're much more mindful about how they present themselves. And so their racism is more subtle. But in the city like Buffalo, with the segregation, it puts a different spin on it, a completely different spin on it. It's not the same as like Maine, where I grew up, where the racism was definitely covert. And you had to figure it out. Here in Buffalo, it is hidden, but it's also not hidden because we're all in our own zones. When I leave my zone and go to, say, Cheektowaga, it's a whole other ballgame. You have people who don't think they're racist behaving in a manner which is like blatantly offensive. And so it's uniquely complex.
Is it the kind of thing, and I know you talk about this in your education and DEI work, is it the kind of thing that is just labeled or considered implicit bias?
I would argue yes. Yeah, implicit. Yep.
Things that people do that they're not even aware of.
I think there are times when they do realize it, but for the most part, I'd say 90% of the time when I bring up something, people aren't even aware. It's become habitual.
And this brings us to a great discussion about language, which I know is an area you study. Give me an example of how language expresses implicit bias.
Wow. It's right on the spot. So I may be walking down the street and I will see someone who is walking really quickly. And if it is a white person, I might go, oh, he's on his way someplace. He's important. He's exercising. But if I see a black person and I have a specific implicit bias towards them, I might just stop, turn around and look and inquire, where are you going? Why are you moving so quickly?
Well, what TV did you just steal?
Explicitly, I would say, what TV did you just steal?
Yeah.
You know what's behind the statement, but I'm not going to say that. I'm just going to ask, are you lost? Do you need help?
And that's the implicit part.
You
would
live here?
just inquire.
Yes.
Okay.
Yes. So it's like I am policing you in my own way, especially if I'm a person who happens to be white. I'm invoking that sense of whiteness that feels kind of responsible for policing the community by making you account for why you're in this space at this time.
And many, many people of color I've talked to used that example in a store. You're in a store and someone comes,
yes.
Can I help you now?
Can I help you? Yeah. And it's like, you don't actually want to help me. You want to watch me move through the store and make sure that I don't steal something because that's what, in your mind, you're assuming I'm going to do.
But that I also look at that as sort of an active thing. Language, the way we express ourselves, can convey an even more subtle implicit bias.
Yes.
Tell me more.
Well, first, language is action. If you're like talking about someone like J.L. Austin and his book, How to Do Things with Words, language, it can be very much in your face. Action, active in every sense of the word. In terms of how it comes out implicitly, it's all about cultural competence. We all know that there are certain things that mean what they mean in our environment. You go to a red light, it turns yellow, you know what that means. everything is a sign. We are all aware of these signs, even if they're not explicit. I am aware of the fact that if I go to a grocery store and I don't get a plastic bag, well, it used to be a grocery bag when I leave, that someone might assume that I'm stealing. That is a sign. So my mother had like this fear, and I'm very much like, save the planet. I don't need a bag. I just have one thing. My mother's like, nope, you always get a bag, because there is an implicit sign there. Everything we do and everything we say is some type of sign that we've registered having a certain meaning. And so we are able to kind of use language in a way that expresses these signs without actually having to say. We can convey the meaning that we assign to the signs without actually saying it explicitly.
Brianna Cornelius is here. She's an educator at the Park School of Buffalo. She works on both DEI, and we'll get to this, DEIB issues. And she's also a linguistics expert, actually writing a book on how language creates our reality. Take it into the classroom for me.
Yes, sir.
When you're dealing with students, high school students, probably more middle school students, are you needing to educate them about the way language conveys those hidden meanings?
Absolutely. Education is language. That's always the first thing I tell them. Well, the first thing I tell them is that none of this is real.
Okay.
All knowledge is man-made. And then they're like, what? And I just like to kind of rock them a bit to get them out of their comfort zones. Yeah. But I like to give them a sense that what we see is language, education, history. It's actually relatively small when you look at the Earth's existence. The universe is like the impact of humans is very limited. And so if you can make yourself bigger than it, then you have an agency and you can kind of take over that knowledge and make sense of the world in the ways in which you wish. So along those lines, I walk in day one and I am walking them through like the ways in which they are going to learn instead of the content that I want them to know, which to me is I try to be very deliberate about that distinction. I want you to learn how to think, not what to think. And I do that to prime them to grapple with the material in a way that works best for each of them.
Put it in the context of anti-racism. Are you teaching them how the things they say could be microaggressions, how certain things convey images that they're possibly not even aware of?
Yes, absolutely. Absolutely. Always making them mindful of what they say. As a history teacher, it's fairly easy for me, history and English, because I teach them the power of language in English. Yeah. But history, when I teach them in the beginning, I tell them it's written by the victors. And so we're going to walk through the narratives, language, right, of the different experiences of these different groups. Let's start with the Native American experience, pre-Columbian contact, all the things you don't know. Let's talk about, Thanksgiving as a concept and the ways in which when we talk about these events, when we talk about historical events that we've learned about, we always show up as the hero in America. How is that reproducing a very specific narrative? How can we begin to talk about these things in a way that honors what happens for as many parties as possible without reproducing these same thought patterns? And
you're defining language very broadly. This isn't just, hey, kids, don't use the N-word.
Yes. Yes, absolutely. Because you don't have to use it. I've met people who've never used it and are just as oppressive as the day is long. You can never use a certain word and have that hatred embedded inside of you. And nobody's born that way, right? So how did you get it? How did you learn that you can navigate life in this way? Through signs. And those signs accumulate to become language. We learn through what we hear.
And you do this at the Park School. Talk about the student population there. I'm assuming it's mixed.
It is, yes. Specifically our upper school. It's very diverse, which I am extremely proud of. We are working on our younger groups. Our middle school, extremely diverse. We have students from all backgrounds. We have a significant number of international students. I think we make a concerted effort to increase the D in our DEIB, but I am very concerned about making sure we increase the environment so that it is conducive to keeping the D there. So there's no point in bringing more people of color or different gender identities, which we also have quite a bit of. We have neurodiversity. We have diversity in a beautiful amount of ways, an array of ways. But if we do not have a system and structure that is conducive to taking care of these different groups of people, instead of trying to push them into whiteness, then there's no sense in bringing them there. And so I think Park does a good job at making sure that all feel included and all have a sense of belonging.
Do students of different backgrounds react differently to your concepts and curriculum?
Yes.
Explain. I mean, some of that's obvious. I ask it just a little bit rhetorically. Obviously, a black student's going to react differently than a white student, but if you could elaborate.
Absolutely. I'm very upfront, first of all, which no one really sees coming. I am not the old honey, sweetie type. I'm just, that's not my culture. And so when you look like me, which no one can see me, but when, as an African-American woman, when I show up in a space that has been historically and predominantly white and wealthy, I mean, let's just be honest, me being loud and upfront and overt is never expected. Of course, the students of color, they find that familiar because we share that, historical, that culture. And so they gravitate towards my means, my approaches, but they also gravitate towards my methods because I challenge conventional wisdom. And so the people who are usually most uncomfortable are my white students, specifically, which is interesting enough, white female students. It makes sense. There's a reason, but
really,
my white students in general, yeah.
You glossed over it, so if you don't want to go there, let me know. But
go ahead.
To me, that's interesting.
Yes,
because I think the stereotype is that the microaggressions or the inappropriate use of language would not necessarily be a white female.
It's not.
And we're talking about what age group? Middle school, right?
Middle school to high school, yes. So the offenses usually aren't white females. But the absorption and understanding of the ways we're supposed to exist in the world affect them in unique ways because in a patriarchal system, female children, if you live according to the binary, are primed to be mothers. Mothers are the ones who pass on our cultural norms, the expectations of behavior. So these girls, or these, I should say, non-cis male students, have been primed to absorb a certain amount of information, how to behave correctly, how to sit with your legs crossed, how to function, and passively keep certain structures and beliefs going. So when I confront those beliefs for them, it's almost like a reckoning because they're realizing that, especially as white women, they're inside of a system that's also oppressing them. But they've been trained to keep it alive through some kind of weird motherhood priming system. Does that make sense?
It does. And I also imagine the fact that it's middle school has something to do with it because that's where you are discovering yourself and modeling behavior
Identity
and figuring out exactly who you are.
Exactly. And I think that's why it impacts them so much, is because they don't have the white boy bro reality that allows them, if we're being frank, in a white patriarchal system, white males are basically allowed to do as they wish, to move freely, to take up space. White women are not. And so they have to make sense of that disparity.
And you teach them that they don't have to fit that mold.
Absolutely.
In the language, in the way they model their behavior, in their lives.
Yes, absolutely. Yes, sir.
Talk to me a little bit about trauma. Okay. I know that, again, if your focus is language, the way people process things is certainly pedagogically related to the language they use. Yeah. In a high school setting, it might not be the trauma of a TOPS shooting per se, but there's a role in the discussion to look at how they process trauma.
Absolutely. When my students experience any kind of trauma, which unfortunately it's commonplace, right, in America, there's always some kind of traumatic event happening. The first thing I do is I shut everything down. I shut the whole class down. And we're not talking about whatever the lesson is today. We're going to dig in. I'm going to create a safe space. I'm going to make myself emotionally available and vulnerable. I'm going to give myself space to fall apart in front of them because I think grieving is important. I think so often we just try to gloss over things. We try to make sense of things. We want to kind of reckon with what's happening, but we don't give ourselves time and space to deal. And at this age, middle school especially, they are losing their minds. Hormones are going everywhere. Their bodies are changing. They're becoming adults, but they're still babies. There's a lot going on, and they don't have the language to process what's going on.
My sister has daughters.
Mm-hmm.
I don't. And she tells this wonderful story around holiday gatherings. We use it to embarrass my niece. She tells this wonderful story about how the teenage experience is often something that is just unfathomable.
Yeah.
One day her daughter came home, threw herself on the bed, and started crying.
Oh.
And my sister goes up to her and says, "Honey, what's wrong?" Mm-hmm. And in the middle of her bawling, she just says, "I don't know," which to me kind of encapsulates that teen experience.
Yes.
If something's wrong, you just don't know what the heck it is.
They just don't know. And so I give them the space to just like, I don't know, to freak out. And then when they gather themselves and they recover, I begin to just allow myself that space, but share with them, I don't know either, but let's find out why. And if you build a curriculum around addressing these structural and systemic issues, you can circle back to it in the case of a traumatic event. You can walk them back and say, hey guys, this is why health disparities in these communities are significant. This is why, in mathematics class, statistics about redlining, this is the actual impact of the things that we've been studying, right? So you can always make your way back to making sense of it with your lesson if you've built that foundation and you've been teaching it all along. And so all year long, I design my curriculum around not so much preemptively anticipating trauma, but I know that it's inevitable. And so it's like, how can we explain this ahead of time?
The Park School in Snyder, you've already talked about the diverse population. Mm-hmm. Did they have a specific reaction to the shootings at Tops?
Yes.
It was relevant to them?
Yes.
Students
or the actual institution?
Yeah, I'm saying the students.
Yes, absolutely.
What did you see?
For my students of color specifically, I opened up an affinity space for them. They came in, we sat, we talked, we grieved. Some of them didn't say anything, which was also a thing. Right. But I spent a lot of time just caring for them because they were confused, shocked, as was I.
They intrinsically understood that these shootings targeted people who looked like them.
Yes.
Okay.
Absolutely. Yes. It took me about 12 hours to understand that when it happened, because when I was first told about it, a friend of mine called me, and I live literally 4 blocks away.
Okay.
I'm on East Utica. And she says, where are you? I said, I'm home. She said, don't leave the house. They're shooting at Tops. Now, for African Americans, when somebody says they shooting at Tops, I'm thinking something has happened. There's a interaction between two individuals.
A conflict between two people, not a guy that drove up from Binghamton.
Yes. It was not, there was a shooting at Tops. And so I have to be very specific about my language here. And so I said, all right, cool. I'll stay home. I'm not planning on going anywhere anyways. It's fine. A few hours later, we find out what's really happening. I didn't process it until the next day when I realized this person had driven hundreds of miles, come here, targeted this space, scoped it out, like made a deliberate act to attack a very specific people. I was also in South Carolina, Columbia, when the shooting happened at Mother Bethel in Charleston. And so like it was like PTSD all over again. So it took me a long time to process that my people were being targeted. My students came in, they just knew. It was there's no denying it. None whatsoever.
What about the white students?
They had a harder time.
Recognizing that?
They had a harder time accepting it. They recognized it, but I think they didn't know. It's like some white adults, if I'm being honest, who were like, oh my God, they didn't know how to process it because everybody's still living under the illusion that racism isn't really real. We're still trying to convince ourselves that everything is okay. And if people just pull themselves up by their bootstraps, everything will be fine. This is America. It was like a rupture for a lot of the kids who genuinely thought that like we were past this. They thought it was over. Like Martin Luther King died. Isn't everything fine? Isn't that what my grandparents told me? Like racism is fixed. We had a black president. And so for them, it was wrestling with the denial versus the reality that, like, no, this was a specifically targeted act.
Throughout the discussion this morning, we've touched on health disparities. More on that in just a moment or two. Jay Moran with Reverend George Nicholas. Dr. Brianna Cornelius is here. She's an educator at the Park School of Buffalo. She is writing a book on how language creates reality, and she's really active in DEI, diversity, equity, and inclusion. Thank you. Had a brain pause for a moment there. But you and many schools, Park School and some others, have kind of stretched that moniker a little bit.
Yes.
Not just diversity, equity, and inclusion.
Yes.
But diversity, DEIB, diversity, equity, inclusion, and belonging.
Yes.
Doesn't inclusion imply belonging? If we're talking about language?
One would think so.
Okay.
And if you do it correctly, if you create an environment that is inclusive, then those who have felt excluded will feel belonging. And so that B is really about focusing on the effect of what we intend to do. It is very important to understand the difference between our intentions and our effects. We can intend to be inclusive, but if you don't have a solid read on your population, you can try all you want. They don't feel like they belong there. They just don't. They don't feel like this is their home. And so the B allows us to kind of hone in on the actual students who are affected by our intended actions to make sure that they are feeling what we are hoping that they are. And if not, to reroute our setup to design it around making sure they feel like they belong so that inclusivity is a natural byproduct. That's
very interesting to me because in the discussions that I've ever heard of DEI, there's always this emphasis on being intentional.
Mm-hmm. Yes, you should be. Yes.
But you're also adding sort of a little bit of an asterisk that says intentionality alone might not be enough.
Absolutely. If I accidentally hit someone with my car, did not mean to, didn't intend to, I still have to deal with the effects. And so intention is absolutely important. You have to be intentional in everything you do, especially with this work. But you also have to be mindful. The problem is that we center ourselves. It's like me, my feelings, my intentions. I'm not racist, instead of centering the person who's involved, their feelings, the effects of my actions.
Them. Make sure they are belonging.
Yes,
that's
so
where the
that
B comes
they belong. So it's about centering them. Absolutely.
Okay. Yep. And that is a little bit of a mindset shift.
Yes, sir. Absolutely.
Are you hopeful?
Always.
Anytime I've asked that question, I don't think anyone has said anything other than that. But explain.
I try not to be too hard on people who lose hope. But in many ways, hopelessness is a very easy ticket out. These are solvable problems. I am not the sharpest crayon in the shed. And that was an intentionally mixed metaphor. But if I can begin to sit and strategize and come up with solutions and take a step back and look at how we got here, there is a clear path on how we got to where we are. And shows like this, efforts like this, show that we can actually take the time to be intentional and mindful about how we can proceed forward. I'm not like the request is not that we levitate and walk on water. These are solvable problems. So for me, hopelessness is just an easy way of saying it's too big. I don't know where to start. And it seems like it might just be easier to give up and not believe. But I don't think you have to believe at this point. It is what it is.
The old cliche, we eat the elephant one bite at a time.
That's right.
Okay.
And there are solutions.
What does, you live on the east side, you said, on Utica, near the shooting scene. More broadly, apart from your work in the DEIB arena, what does the region need? If I gave Dr. Brianna Cornelius a magic wand and she just waved that thing all over the place, what would happen?
Well, first of all, it would be pink and glitter would be everywhere.
All right.
I'm a huge fan of Pinkalicious, by the way, on the show, and she walks around with her wand. The one thing I think, if I could wave this wand, it would be really to make everybody really uncomfortable. I think our biggest issue, the greatest barrier to change, as far as I'm concerned, is volition. We have no desire to truly change the systems in which we exist because in some way, shape, or form, we benefit from them. And that's all privilege is. It's collateral that guarantees that we won't fight back against a system from which we benefit. But in order to get us to the space of the desire to change, there has to be a significant amount of discomfort. And we're not ready to sit in that discomfort and truly have a reckoning with ourselves individually and as a nation about how we have contributed to, participate in, even unwittingly. And in some ways, we do believe in these systems that are oppressive. And so if I could just make everyone really uncomfortable, fall on the bed, cry like a teenager, and just say, I don't know, that is the cracking of that ego-like shell that I think will begin to get us towards the direct path. There is no end point. We only move towards freedom. We're moving in the wrong direction. And so to get us to turn around, that magic wand would start to break some hearts, not to crush them. But
even though it's spreading sprinkles and rainbows.
Sprinkles and rainbows. I'm going to make you cry, but it'll be okay. I'll bring Kleenex. It's okay. Yeah.
All right. Fair enough. Dr. Cornelius, thanks for being here.
Thank you so much for having me.
Great discussion. Coming up next, and you heard her talk a little bit about health disparities. We're really going to get into it. Social determinants of health. Pastor George Nicholas is next with Jay Moran. Stay with us.
Hey, we used to love this song. We still do, but we used to too. WBFO The Bridge, college radio for adults. Check us out on the TuneIn app or on your smart speakers and, of course, WBFO.org/thebridge.
Sometimes we miss our morning alarm, then we miss our morning news, and the whole day is off. That's when you can listen to the WBFO Brief Podcast to catch up on the day's news and get back on track. Find it every weekday wherever you get your podcasts, and then like and subscribe so you never miss the award-winning journalism of WBFO's news team.
This is Buffalo What's Next, where we have conversations with the community about moving forward. To have your voice heard, press the Talk to Us button on the WBFO app, and we'll work to get your questions and comments on the air. Join us on Twitter at WBFO or email us at news@WBFO.org. Together, we'll have the conversations that are needed. This is WBFO, your NPR station.
And welcome back to Buffalo What's Next. And we continue our conversation this morning. We have Reverend George Nicholas of the Lincoln Memorial United Methodist Church on Maston Avenue. Also, and this is really more of our focus here, the Co-Convener of the African American Health Equity Task Force, started in 2015. And they've had some very interesting offshoots since then. But the problems haven't really changed in a lot of ways. Reverend Nicholas, thanks for joining us.
Good morning. Thank you for having me.
Most certainly. Maybe just to go back and so we understand what we're doing here. Like it's 2015, the Health Equity Task Force begins. What was the initial idea?
Well, when we really kind of birthed out of a conversation about colorectal cancer and the high rates of African American men with colorectal cancer, and I said, well, I challenged the group. I said, let's look deeper. Let's look at, all health outcomes for folks in the African American community, and specifically on the east side of Buffalo, about 5 or 6, 7 zip codes where about 80% of black folks live in the county. And let's look at state and county data and see what some of the health outcomes are. And we knew just from looking at things that the data was going to show tremendous health disparities. But what we were surprised in our research is that how pronounced it was, to the point where an African American who lives on the east side in one of these zip codes, 1-5, and all these others, that that they would have a 300% higher rate of chronic disease, higher rate of prevalence than a white person who lives outside of that community, meaning things like heart disease, diabetes, hypertension, asthma, all these kind of things. And what's interesting about a lot of these things, they're preventable, treatable, but we just have a disproportionate amount of people in that community who are suffering from these chronic diseases, and that's because of the social determinants of health.
Hey, I was going to get into that because I saw this on the website. We will give the community the language to explain health disparities through the lens of social determinants as opposed to only, quote-unquote, behavior as a strategy narrative change. And that's a big element here because, right, like you just alluded to, well, if you have to change how you live, change your diet, change your exercise, it's that simple, but it's not that simple.
No, it's not that simple at all. And it's not just us saying it. I mean, the World Health Organization, the Center for Disease Control, every reputable organization and university and healthcare system that addresses issues around health outcomes will tell you that it's the social determinants of health, the lived environment, that have the greatest impact on health outcomes. So even when you say to a person, and what are the social determinants of health? We're talking about where you live, right? Your ability to obtain education, your interfacing with the criminal justice system, the environment, the air and water quality, your actual income, and your wealth. And when you look at all those factors for African Americans, there's a huge disparity between those who live in those communities and those who do not.
It almost becomes an awful algorithm to kind of use a modern because if you look at all, like you said, if you take that, somebody lives in one of these zip codes compared to somebody who lives in a zip code of, say, Clarence or Hamburg or whatever, those levels of those determinants are going to be higher, and somebody growing up in 14204 is going to be most likely going to be behind.
Yeah, the data shows it. I mean, it's not it's not like a hypothesis or anything. I mean, the data shows this, and it gets so bad that for African Americans who live in those communities, they can live 10 to 12 less years than a white person that lives outside of those communities. That means less time, with your grandparents, going to weddings and graduations and the births of grandchildren, less wisdom and knowledge that is passed on, and then you have such a high level of people who are I'm dealing with a family right now who, with dialysis and things of that nature, which really impacts the quality of life of individuals. Higher number of people with diabetes who have amputations, sometimes 8 times higher for an African American to have an amputation than a white. So, I mean, the numbers are like really, really staggering. But again, it goes back to the social determinants of health, the lived environment. We talk a lot about helping children, and I think that's a great thing. It's always easy to say, let's raise money to help a child. But the reality is, can you really help a child without helping their family? And can you really help a family without helping the neighborhood in which they live in? And you really have to look at that kind of a more of a holistic perspective, right? And look at all the factors that may be barriers for a person to have to live a healthy life. And then we have to address those things, right? You cannot just kind of put Band-Aids on or create a program without looking at the macro issues that created the disparity at the first place.
And well, it's, I think, worthwhile to talk about your history here in Buffalo. Grew up in Buffalo. Mm-hmm. You went away for a while for both for school and for some of your other pastoral work. So you have a perspective to look back at these East Side neighborhoods from 30 years ago to now. It's gone downhill, to say the least.
I mean, you could, and you look at the amount of vacant properties. You look at the lack of black-owned businesses that were staples in a lot of the community, and the general condition, right, of the community is not as good as it was in the past, and it's documented. So Dr. Henry Taylor, in his report "The Harder We Run," clearly documents, the impact of residential segregation, the lack of black home ownership, and the fact that even in spite of the fact where there's been billions of dollars invested in the renaissance of the region, this community still experiences, high poverty rates, low home ownership rates, high chronic diseases. The children in the school system are not performing at the same level as white children in suburban areas and things of that nature. So the measurements, and it's not, sometimes when you raise these issues, people think you're being cynical and whatever. No, it's not really being cynical at all. It's just being able looking at reality so that we can prescribe remedies that we can shift this. We shouldn't. I don't accept the notion that, well, you're in a community, you're just going to have certain pockets where all these quality of life issues are significantly worse than other communities. I'd reject that, right?
Certainly.
And so if you see in certain communities just a number of issues, then it's incumbent upon leadership to address those issues in a meaningful way.
We talked a little bit before we got in here about priorities.
Yeah, sure.
And it is interesting, and you brought it into perspective. For example, if 10 years ago you and I were walking over where the Odd used to stand in downtown Buffalo, when we looked out and we would wonder, there's going to be change in this place. This is going to look different, and it looks dramatically different now. It's a very vibrant place to be. You argue it's because it was prioritized.
Sure. And so, it's not begrudging. I think it's great.
Of course.
Yeah, I think all of it's great. But also it shows what can happen when government, business, and institutions come together and say, listen, this is something we want to do. Look at the Jacobs School of Medicine, that was, the University of Buffalo and government and private industry and others saying, hey, this is something we want to do, right? And boom, there it is, right? And so we just have not prioritized the redevelopment, the reimagining, reengineering of the East Side, and particularly it just hasn't, the quality of life and the lived experience of Black people in Buffalo and in Western New York has not been a priority for this region for a long, long time, right? And as a result, because it hasn't been a priority, we see what we see, right? It doesn't happen because of just some kind of divine action, right? I mean, it's, I'm a theologian, right? So there's things that happen because of divine action, and there are things that happen because of the actions of man, right? And the fact that we have such crushing poverty when we had the May 14th incident and with the shuttering of the supermarket created an absolute crisis of access to food for a large number of people who don't even necessarily live a few blocks from Tops Market over there. I mean, just living in proximity, right? Created such a food crisis that we had to have the World Central Kitchen locate, an organization that's in the Ukraine, that's in Puerto Rico.
It goes to disaster areas.
Yes, that they felt like a need to come to the east side of Buffalo and to set up shop to give people food. It's a wonderful thing. It's a good thing, and I applaud them for doing that. But then we have to sit back and evaluate, what did this incident on May 14th, what did this expose?
It's interesting you should say that, because in this morning's paper there was an article about some of the money that's going to be distributed through some of these funds and such. And Deanna Eason of Housing Opportunities Made Equal, this quote, I think, boy, it hits it. She said, "That scab is ripped away again." And that's the way it feels, right, for that community. That people were living with what they had, maybe healing in their own way, maybe not healing healthy. But all of a sudden on May 14th, that scab, that sensation of pain and was just exposed once again. And how about it in your church? I mean, what have people been talking about?
Yeah, well, that Sunday, so May 15th, I think it was, right? It was a very interesting Sunday, and I would say that the most visible and pronounced feeling was anger. One of our members' uncles, Haywood Patterson, was murdered in that space, and then others in the congregation talked about people who they knew who lost their lives, and there was just an overwhelming sense of just anger. Even in we're a Christian church and we believe in forgiveness and grace and all this other stuff, but the reality of human emotion is and dealing with circumstances. We were transparent enough to really talk about those issues, and anger not only limited to the incident itself, but the condition, right? The condition of just, again, here we go again, another thing that's going to cause pain and suffering for our people. And so, but in the midst of that anger, there's resiliency and the understanding that regardless of the situation, because of, we stand on the shoulders of our ancestors who were, enslaved and dehumanized for since 1619 in this country, that we got to press forward. We got to rebuild. We got to come back again. But it's exhausting. It's emotionally exhausting, and because of structural and systemic racism that's been pervasive in this country from our inception. It creates just trauma and exhaustion, frustration, and anger, and quite frankly, we're tired, and we're tired of always being told to wait. How do you think it makes and we. Black people are probably some of the best football fans we have. Black folks love the Bills, but think about a community that where there's massive residential segregation, where large numbers of people are paying more than 45% of their limited income on rental properties that are many times substandard, when they're sending their children to schools on the failing school list, when they struggle to be able to get an increase of wages, while inflation goes up, wages haven't gone down, and all this trauma that we deal with. And then seeing that government and others, handing $850 million to a billionaire for a ball stadium, right? But then when we're told that, here are things in our community that we need, we're always told to wait. Or we're always told we don't have the money, or we got to figure it out. We got to see where we can get those dollars. But then you see, in recent history in this community, we saw, Elon Musk, one of the richest men on the planet, get $750 million of government money, right, to do what he did. Now you're having another billionaire getting almost $1 billion to do what they need to do. And then yet a community where we've documented all these terrible health outcomes, where people have been struggling with issues of access to food. I mean, think about, you got to get your mind around that. In the United States of America, in the year 2022, Americans, right? Many of them work every day, right? Have to it's like, the grapes of wrath, Steinbeck, you know what I mean? And standing in line to get food. Are you kidding me? And then at the same time, we have monies, to do everything else that we want to do in this region. But then when it comes to the time of let's reimagine, let's revitalize, let's do these things for the Black community, we're always told to wait. And it's just, it's untenable, and I'm hoping that this moment, this response to the May 14th incident, will be a moment that will trigger a greater sense of urgency and a greater sense of prioritizing the needs of Black people in this community. And I speak in those terms very unapologetically, the needs of Black people, because the data shows that Black people are suffering disproportionately in this region, to the point where our bodies are infected with chronic diseases, with dying younger, and it's just, it's just something that we need to address right away. It should have been addressed a long time ago.
We're talking with Reverend George Nicholas of the Lincoln Memorial United Methodist Church here in Buffalo, and also co-convener of the African American Health Equity Task Force. That's actually our main thrust here, but it is all interconnected, isn't it? And you talked about, like you said, the priorities have been there for a long time for black people in Buffalo, but have gone aside. Political leaders in Buffalo, some are black. What about that? What's going? What? How do you assess that? Is it just a matter of political power belonging to a small handful of influential people who are able to kind of get their way with City Hall, or
it's just priority? It's just it's about priority, making the needs of our people a priority, and being fearless about saying those things, about inviting other leaders in the corporate community to go beyond charity and to start talking about investment and root causes. So traditionally, the role that corporate America has played in these issues in the city of Buffalo has been just really about a charity, and charity's good. I'm not against that, but there hasn't been real engagement across sectors, right? Across the political, institutional, corporate, and grassroots community-based people sitting around the table and really talking about how do we really wrestle with these root cause problems and then resource them, right? And so I hopefully at this point in this journey here that we'll recognize that it's important for us to build these tables, and that community people who live in these communities have a right to be at these tables, and their voices need to be heard. And there's a responsibility, both civic and morally, by political and business leaders, right, to work on solutions to these issues. And there just hasn't been that type of making that a priority. It hasn't been that type of leadership emphasis that on these issues, and as a result, we haven't seen the change that we need. And so I think we have an opportunity here. I think one of the things that I'm most proud of, in my work as, leading the Buffalo Center for Health Equity and what have you, is that we are engaging corporate leaders. We are engaging people at the community level. We are engaging.
But are they responding with real imaginative response? Like you said, if you go into corporate boardrooms, there's all sorts of ideas to get all sorts of things done. There are brilliant people inside there. There's processes in place to get done what that corporation needs to be done. Do you feel that what you're seeing now or hearing now is changing?
Yeah, I mean, I only can speak from the spaces that our organization is working in, right? And so we have evidence. The Buffalo Center for Health Equity is fully funded as an institution to work on the issues that we need to work on. The University of Buffalo has stood up an institute within the university, the UB Community Research Institute, that's specifically addressing the issues around health equity. And now the Erie County, under the county executive's leadership, have stood up an office for health equity within the county health department. So there's spaces now to get the work done. And there's conversations that there recently, I'm on the board of the Population Health Collaborative, and we've recently merged with Healthy Link. And if you go back and look at this stuff, this new entity has clearly said that working on issues of health equity is going to be a priority. It's going to be part of our DNA as an organization. And so those are just, examples. And
sure.
Then you have people like, Jericho Road and the Raul Vasquez and all those others that are out there in this space that are building the type of collaborations that we can address those things. So it's monumental work, right? But I do see, tables being created now to have these conversations and to begin to start, thinking about ways in which we can address these root cause issues. It's takes a lot of work, right? But you got to start somewhere, and so I feel pretty good about where we are in some of those spaces. And a shameless plug, we're having our next Igniting Hope conference on August 13th, and we invite everybody to come and to
what
engage.
What would we learn if we can?
Well, I mean, we have lots of speakers, but the main thing we really want to talk about, again, what is the next step of our work, right? And I think really one of the next steps is community engagement at a much greater level, right? We really got to have a much richer understanding of the needs in these communities and how we can address those needs. And I think the best people to tell us that are those who are living in those spaces, right? And then mobilizing institutions and other organizations to do what they do to address these issues. So it's not sexy. It's not as easy as just like going and handing people stuff. It's my feeling that sitting down and having conversations, trying to figure out what to do in a bigger way is where we should be going right now, and then acting on what we learn. And one of the things that I think could be a great outcome is really, they've talked about it in the past, is doing a type of a demonstration project in a isolated neighborhood and just pouring in the resources, doing the things that you need to do
to show what can be done.
Yes, and then just multiply that. And it happens in other cities that have done those kind of things.
Yeah, you mentioned other cities. I've had an opportunity to talk to some other folks who've lived in other cities to compare and contrast their experience. You spent time with your ministry in Rochester.
Yeah.
How is life different for Black people in Rochester than in Buffalo?
Not that much. We had done some work there.
The home of Frederick Douglass.
Yeah. I mean, the struggle is pretty, it's really Black folks in urban America and all in America that are struggling, right? But there are pockets. There's some great work that's being done in Cleveland, Ohio, and recently I was in Pittsburgh and saw some good work that was doing.
Can you lay that out? I mean, let's take the final moments of our discussion about imagining what maybe you saw in Pittsburgh that could translate into Buffalo.
Well, the main thing really in Pittsburgh that I saw and in Cleveland were the partnerships, the corporate entities willing to engage with community and make an investment, right?
Putting a corporate office there.
No. I mean, for example, we'd been in conversation with this woman named Heidi Gartland that works with I got the name of this place, Cleveland. It's not the Cleveland Clinic, but a Cleveland Health System, and they have got engaged in doing some things around housing. Doing some things around creating access to food, doing some things about creating access to health care and transportation issues and all these things, and working with the community in a part of Cleveland, not the whole city, right? And have been able to see some outcomes, right? And one of the things that Heidi shared with me is that the corporate entity having to acknowledge that some of this work right now won't be profitable. Right?
A key element there.
Yeah. So there's an investment we're going to have to make that we may not see a return on right now, but it's the right thing to do. And then over time, as the community becomes more stabilized and whatever, it's a more vibrant community. And that's better for everybody, including corporate entities, right? So there's a level of altruism, and then there's a level of self-interest, and that's the reality of America, right?
Certainly.
So embrace it instead of having these philosophical conversations about things. Recognizing the reality of the situations in which we live, and impressing upon the corporate entities in this society that there's a value add.
And we'll have to leave that as the last word. Reverend George Nicholas, thanks for joining us on Buffalo What's Next.
Thank you for having me.
Reverend George Nicholas of Lincoln Memorial United Methodist Church on Maston Avenue here in Buffalo. Also the co-convener of the African American Health Equity Task Force and also the Buffalo Center for Health Equity. Our guest in part 2 of today's Buffalo What's Next. Also want to thank our first guest, Dr. Brianna Cornelius, linguist expert, talking with Dave Debo earlier in this hour. And coming up on Monday on Buffalo What's Next, Dave is going to have an hour-long conversation with Thomas Buford, the new executive director of the Buffalo Urban League. This has been Buffalo What's Next, and you're listening to WBFO and WBFO HD1 Buffalo, WOLN Olean, and WUBJ Jamestown.